You're heading the SRCC Oncology for Pediatrician departments. So, and we're celebrating the World Cancer Awareness Day today. So, normally we associate cancer with adults. So, is it that children can also have cancers? And if so, what are the types?
Thank you for having me here, and I greet all children and parents on this occasion of International Childhood Cancer Day, which is 15th February today. And I wish to pass on the first and most important message is that childhood cancer is highly curable if diagnosed early and treated appropriately. Now, having said that, I would say that yes, children do have cancer. Generally, we associate cancer with adults, but childhood cancers are quite different in the sense they are not lifestyle related cancer as in adults. Like we always say that if you smoke or you chew tobacco or you are obese, sedentary lifestyle, you are more likely to have cancer in adults. That is not the case. Childhood cancers that way are different. They are not inherited as has been the common belief, because if you get it in child, is it so barring few cancers like retinoblastoma, that is the cancer of the eye, where it can be inherited from parents to the child. Most of the childhood cancers are not inherited, but their origin lies in the genetic changes which may occur. One insult can occur while they are in their mother's womb, uterus, but the if not all those who have these changes they translate into cancer, but if they get the another hit, then only they can develop the cancer. So there is a this two hit hypothesis. One hit inside and then one hit additional hit outside can lead to cancer. The most of the childhood cancers are not like organ cancer. Like in adults, we have a cancer of the stomach, cancer of the intestine, cancer of the breast, cancer of the lung. So they are organ restricted cancer. They originate in that organ and then they slowly, if unattended, they can spread to local region and then spread in the whole body, become metastatic. While in children, it is mainly the developing child has a very active growth of the various tissues. Their cells multiply, they grow in size by multiplication. So, when there is a second hit which occurs during this growth period, whichever is the tissue that gets affected develops a cancer. So, it is more of those tissue rather than the organ. Like if you have the bones which are growing, if that gets hit, then you get bone sarcoma. If you have a neuronal tissue, peripheral nervous system, you can get a neuroblastoma. If you have a brain tissue which goes haywire, then you can get brain tumor, so on and so forth. So it is basically the multiplying or growing tissues which can have a second hit, and you have the cancer of that tissue. Lymph nodes, you can have a lymphoma, things like that. So that is where. So we divide the childhood cancer into main two divisions: liquid tumors or hematolymphoid malignancies and solid tumors. In hematolymphoid, it is mainly, as the name suggests, it is involving the blood forming organs like bone marrow, lymph nodes, and you have leukemias. Generally, they are very fast progressing acute leukemias, high grade lymphomas, Hodgkin's disease. This forms the hematolymphoid, which is half and half distribution. Half of the childhood cancers will be totally this hematolymphoid malignancy, and most commonly known amongst them is the acute lymphoblastic leukemia, which is in a colloquial parlance or a common man's vocabulary, it is known as a blood cancer. While in the solid tumors, you have various, like it can be many types. Like nervous brain tumor is the most commonest. and then you have a which is almost 25%, and then remaining are many organs. So there is a rarity. That is the biggest problem in childhood cancer. In India, where there are millions of children, there are only around more than 50,000, around 50,000 new cancer cases, pediatric cancers every year. But 50,000 sounds a big number, but as compared to the population that we have between 0 to 18, it is a small number. And a pediatrician who generally attend to these children, they don't see this very often, and hence they can miss the diagnosis. While and most of these cancers, pediatric cancers, they don't have a telltale signs or symptoms. That if this is so, then this is the diagnosis. Generally, they come with a very vague symptoms, which are like a common childhood ailments and can be missed.
Sure.
So the awareness amongst pediatrician and alertness, which we try to bring out by doing some training programs of pediatricians through our national training program for practical pediatric oncology, which is going on for a long time, and it has helped that pediatricians have understood many of the symptoms and they become alert. And now we are seeing the trend that the children get, like, they get alerted fast and they come. But even though you suspect a diagnosis and you tell the parents that it may be like, we are always hesitant to spell out the name cancer, and the pediatric, because of the stigma or the fear that is attached with it. So pediatricians also, or the doctors who are referring to the higher centers, because these treatments are quite diagnosis plus treatment, both are quite complicated and difficult. So generally that happens at a tertiary level in either a children's hospital or a cancer center.
Sure.
And uh, the referring person doesn't spell out that it can be cancer and you go. They go roundabout and don't emphasize the need for early diagnosis, and that's how many of the parents, when they come, they say that we never knew that it can be cancer. Our doctor said that you must go, but we took little time to reach here, because they have to come from the small places, remote places, to a bigger cities where these facilities are located. So everybody takes time to reach those facilities. They are fearful to bigger cities from the villages. So all this takes causes delay even after being suspected. And then having come to the bigger cities and huge hospitals, they get very intimidated. They have to be navigated and they have to be retained in the place for completion of treatment, because diagnosis but not completing the treatment is not going to give you the results. So that is why they have to be sustained through this long journey in a unknown place. They have a problem of staying, they have to have a problem of looking after themselves. The parents, child is dependent on the parents, so they have to leave their job, other siblings are at home. So a lot of it is not only the disease of the child, but it is a really whole family problem, and it has to be looked up that way. So everybody from the society, they have to come together to support. When we started the journey, it was all mixed, adult and pediatrics, but we soon popularized, or we said that the child is not a miniature adult and has different needs. First and foremost, the diseases are different. The outlook for the disease is different, because if you treat a child, you are going to have a productive years of life ahead, and they are truly cured, as opposed to adults who are most of the time controlled, and the disease may come back depending on the situation. The adults are in command of themselves, like they take their own decisions whether to treat or not treat themselves. They have financial independence, they look after themselves, while the child is dependent on the and has no voice of his or her own. So parental education and their support is very very essential. And many of the parents, they have difficulties because of earning livelihoods, looking after the family, other responsibility, other children. So all these things complicate the whole story. And that is how you need a lot of support from all the sections of the society to go through this journey.
Absolutely. Thank you, doctor, for sharing and busting the myth that it's not hereditary. And so, what are the early symptoms, and are these curable?
No, the diseases are, the dictum remains that if you diagnose early, they are curable. And there are most of the common cancers in pediatrics, they are highly curable, like acute lymphoblastic leukemia, Wilms tumor. Everything is in excess of 70 to 80%. But this is when you are able to treat optimally, as it, the whole treatment has evolved in the Western countries. And if you are able to give that, so that is how it is important that we give appropriate treatment. And such treatments are possible in either a specialized cancer hospital or a specialized children's hospital, like with all the support as it has been happening in SRCC, because they go through difficult period. You require the care of the support of intensivist to go through the fever, infection, they are more prone to. You require a very strong blood bank to support with the requirement of blood transfusions and platelet transfusions and so on. So you need that kind of support. And if this is available, which is the case in bigger centers like ours, but not so everywhere. And that is why if they succumb to the complications of treatment, like infections during treatment or bleeding during treatment, the understanding is that child died of cancer. But child did not die of cancer, but child died or could not make it because of the lack of supportive care, nutrition. All these things are very very important if you have to have a success. And if everything is available, as I said, it is the highly curable cancer, and cure in true sense.
Sure.
Like if a child is treated and remains well beyond 5 years from diagnosis, or at least 2 years from completion of treatment, then we call it survivor. And the likelihood of the disease coming back in this survivor is very less. But they need to be kept under surveillance almost lifelong, because they can have problems related to the treatment that they have received. They are young children, so they are given very intensive chemotherapy, some surgery, or even they may need a radiation. So all this is an insult to the growing child, and the normal tissue also can get affected. There are some organs at risk. So all this we have to keep in mind and keep them under surveillance. So the disease may not come back, but you may have some quality of life issue because of the morbidity that is associated with the treatment. So that follow-up is very very essential, and we do that in our special separate clinic called after completion of treatment clinic, that is ACT clinic.
Okay.
Which emphasize that much actions are needed beyond therapy to have the cure in its true perspectives in this children.
And how expensive are these treatments?
These treatments are quite expensive. Now they are available. One and foremost thing is that when I started my career, most of the things were not available and were getting imported with a very heavy duty. Now many of the drugs are generic and they are made in India. Those which have to be imported also, many of them have a tax and duty exemption. So they are available first and foremost. The availability is there. But some of them are really costly. And we have to also remember that it is not the treatment cost alone which matters. It is the cost of the supportive care. Like today, they undergo difficult infection. They have difficult infections. The cost of the antibiotics can be exorbitant. They get exotic infection like fungal infection, viral infection. The cost of this is very exorbitant. So, if I have to say that it is only 30 to 40% which is a chemotherapy or a treatment cost. Remaining all is a cost of supportive treatment, because you have to sustain these children to go through this difficult treatment with all this supportive care. So generally that is the ratio. Almost 40% around that is chemotherapy or other cancer related treatment, and 60% is so it is it is costly. And if it is a simple disease, the cost is, it is not same for everyone. We, what we call it is, we, each disease has its own biology or a behavior, and we classify them into a standard risk. Generally most of the diseases have, we look at all the parameters and say that this child can be treated with a very simple treatment, and if it falls into that simple treatment category, the treatment cost is not there, the other related problems are also minimal. While if the child's disease behavior is a high risk, you need to also give more intensive treatment. So the treatment cost goes up with the intensity of the treatment, and because of the intensity of the treatment, your supportive care also doubles up. So that complicates the financial, morbidity goes up because
Sure.
of that. So it is from disease to disease, and same disease also, what is the behavior of the disease, which decides the treatment and which decides the cost.
Sure. Your final words for the society, how they can come together and support the cause.
Uh, Everyone can, every drop in the ocean counts that way. Whatever you can do for these children really counts. If you have money, give money. If you have time, give time for emotional supports. If you can think of innovations like creating a place to stay for them while they go through treatment in bigger cities, people, organizations have done that. And have a diversion therapies, or divert their
Alternate.
mind during
Okay.
this difficult period,
Journey.
that journey. That, so everything matters from all of us.
Absolutely.
Besides the professional help which we are there to give, every help counts.
Certainly, certainly. We'll urge all our viewers to come forward and support the cause and cheer up the young warriors. Thank you so much, Doctor. It was a pleasure talking to you. Thank you.
Thank you.